Medusa piercings, pros, cons, advantages, disadvantages. Also going to talk about what you should know before getting it done, what the piercing procedure is going to be like, aftercare, how you take care of it, jewelry, living with a piercing, and what happens if you decide, hey, it's not the thing for me, and take it out. Coming up next on Pros and Cons by a Piercer, Season 2, Episode number 45. So you stay right where you're at and stick around. For those who are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here inside Skin Kitchen Tattoo. The piercing we're going to talk about today is the Medusa piercing, also known as a Philtrum piercing, because it's pierced through the Philtrum, which is this thing. You know, that indentation, often referred to as the Cupid's bow. I'm not quite sure why, but that's what they call it. Done in the center of the lip, usually about mid-level or a little bit lower, depending on where that tendon's at inside your mouth. Now, like a lot of lip piercings, most of them developed in the late 80s through the early 90s. This one really didn't pick up steam and become very popular till the early 2000s. The legend behind where the Medusa name came from is that it comes from a Canadian hairdresser. Why that person chose to call it that or what the point was, nobody knows, but it's a cool name for a piercing, I guess. Now let's get into why you're here. Well, one of the many reasons you're here. The pros, the advantages, those things that make you go, yeah, man, that's the piercing for me. Starting with number one, this has a long history of healing. This is not experimental. This is not new. This is not cutting edge. It is something that's been around for a long time, and we know it will heal. Number two, there's less movement, thus less contact, so this piercing tends to cause less damage than some of the other oral piercings. I'm not saying that there's no risk, but there's a slightly reduced risk over, say, a Labret piercing or a lip piercing. Number three, there's a huge or large variety of jewelry out there and jewelry options. The Labret stud is a very common piece of jewelry. There's a lot of different ends you can do, from very basic balls and discs all the way up to very detailed medallions and all kinds of crazy, wacky stuff. Number four, this is a fairly quick healer compared to other piercings. You're usually looking at a healing time that's, I think, on the safe side, 3 to 4 months for most people. It's not really one that's known for problems. Pretty easy heal. And the last one, number five, unless you sleep directly on your face, which makes it hard and very difficult to breathe because basically to have pressure on that part of your body, you pretty much be blocking off your mouth and your nose. This one doesn't affect sleep as much as other oral piercings or other piercings that are located on your face. Now, if you like this, of course, like it. If you found it helpful, like it. If you haven't already, subscribe, hit that notification bell so that you're notified every single time we post something. And if you have something to add or you'd like to ask a question, please leave a comment. Now let's move on to the disadvantages, the cons, the bad things, the things that make you want to send this piercing to time out and have a very tall cocktail. Starting with number one, risk to damage of gums, teeth, and the bone structure of your mouth. You have a metal object that is in your mouth, regardless of how well it's placed, no matter how well the jewelry is sized, there is always a risk. There's also the risk of the ends coming unscrewed and ending up in your mouth while you're chewing on a Reuben or a fish taco, and you end up chipping a tooth. So there is always that risk there. You can limit the risks, but you can't get rid of them. Number two, scarring. This, like most oral lip-style Labret piercings, leaves a lot of scarring. They tend to look open longer than other piercings. They're a lot more visible. They're on your face. They can affect things that we'll talk about here in a little bit. But it is one of those things that you need to consider, that a lot of people have this idea that, oh, if I take it out, nobody's going to notice. they are going to notice if they look close enough. And it's going to look like you still have the piercing, possibly years after you've taken the jewelry out. And that moves us on to number 5, swelling. This piercing is going to swell like all oral piercings do. There are precautions you're going to need to take to affect that, and we'll get into those a little bit later on. But it can be uncomfortable, and it can cause issues. Plus, it makes us put extremely long jewelry in a piercing that does not need long jewelry. Meaning, you're going to have to downsize at some point. Number 5, can limit employment. It is a facial piercing. Depending on what part of the world you're in, how conservative that area is, and what type of career you are looking for, and whether or not you're established in said career, it can affect whether or not you can be employed or find employment. It can also affect your ability to participate in organized sports and such type events, because many of them have now this dress code that requires that you do not have any type of visible piercing. And a bonus con, diet change. This is a temporary thing, usually within the first couple weeks or week, but you're going to need to change your diet. This will affect eating well after the piercing is healed, especially with larger objects like big hoagie sandwiches. I must be hungry because I keep thinking about sandwiches. If you like merch, you like t-shirts, you like swag, check out our merch store. Link is down there in the description. Now let's move on to what you should know beforehand in preparing to get that piercing. First thing is, if you're employed or involved in an organized sports or activity that has maybe a dress code, you should discuss that with your employer or coach or whoever's in charge, or get out that handbook they gave you when you first started and actually read it. This may affect whether or not you'll be able to participate in sports, and it may be one of those situations you come into work on a Monday with a Medusa piercing, they might be sending you home. Also, your piercer should be experienced, knowledgeable, and have done a number of these piercings. They should be very informative, very passionate about what they do. They should love educating you on everything you may possibly need to know before you get this piercing done. Now, the other thing is jewelry needs to be longer than what's actually needed. Because of the swelling, we do oversize the jewelry, and it will need to be downsized. I'll get a little bit more into that later, but usually at some point you're going to have to invest in additional jewelry, and it's for your benefit. Now, this is going to affect eating, diet, etc., so plan ahead. If you have a couple days off from work, especially if you're in a job where you have to talk a lot, like mine, it's a good idea to do it when you have a couple days off where you don't have to do a lot of talking. Also, stock up on things that you're actually going to be able to eat. This doesn't affect eating as much as, say, a tongue piercing would, but it's a good idea to get simple things that don't involve a lot of chewing, easy to eat, cold, stay away from hot items, and have all that stuff beforehand instead of running around with this newly pierced thing and being a little uncomfortable in dealing with it in the process. Have it at home, have it in the freezer or the fridge or wherever you put your food. The other thing you want to do is you want to pick up Biotin antiseptic mouthwash or an alcohol-free mouthwash. I also suggest sea salt in warm water for rinses. So having that stuff at home, you can just get your piercing, head on home, put on the comfy pants, and just relax. Lastly, the other thing you're going to need is probably sterile saline in a can. Most commonly, Nelman's piercing aftercare or wound wash. You need to find out if your piercer does supply that, if they give it away with the piercing, or if it's additional price, what have you. It's my experience that most piercing studios, they give you a bit of a discount over the retail places with this stuff. You're probably going to get a better deal. Not always, but sometimes. Lastly, cross-contamination prevention. It's going to basically involve things like washing your hands before you handle it, no oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks, probably more closer to 3 months, and understanding that even after the piercing is healed, you are more acceptable to STDs during oral sex. During the whole healing process, you are going to need to practice safe sex. Know that in advance and stock up if need to. Keep your environment clean. Clothing, bedding, towels. Do not submerge the piercing in bodies of water you can't control the quality of, which is pretty much anything that is other than something you can clean out and then put clean water in, like your bathtub. Everything else, microorganisms, dangerous. The other things are keep pets away from it. Don't let them sleep in the bed with you, especially smaller animals like to sleep over your face and smell your breath or whatever they're doing all night long and are attracted to shiny objects. The other thing is to avoid makeup in the area, especially cosmetics or foundation makeups. If you use any type of cleanser that tingles or is gritty or has abrasive particles in it, exfoliating, whatever they call it, keep those away from the piercing. Make sure not to share any food items with anybody else. Make sure that your own utensils, same thing with utensils, make sure your own utensils are cleaned on a regular basis. I usually suggest starting with a fresh toothbrush and keeping it out of the bathroom and storing it in an airtight container. Now let's move on to the piercing experience itself. First and foremost, I should give you a consultation. Many of the things I already talked about should be covered in that. Then you're going to have a jewelry selection. When starting out, it's going to be a longer post, but you really might have a number of options for that end that's going to be on the front. Basically, everything from simple balls all the way up to gem settings, really elaborate settings, all kinds of crazy stuff out there. Understand that the more points and edges are on this, the more likely it's going to get caught. I generally suggest kind of starting simplistic at first. With this piercing, depending on the shape of your face, larger pieces do look better. They're a little bit more noticeable than the super small ones. Now you're going to probably sign a waiver, and they're going to start setting up and disinfecting the area. Once they've gotten set up, they'll disinfect it, usually with a surgical scrub. They may have you rinse with Biotene antiseptic mouthwash or an antiseptic mouthwash, and then they will begin the marking process. With this one, you want it kind of dead center or appear to be dead center. Everybody needs to understand that your face is not symmetrical. It's actually a little off, and that's part of nature. And it's a good thing, because if we all had symmetrical faces, we'd look weird. So, as far as the depth, two things to consider. What type of pieces do you plan on wearing in that particular piercing? If you're going to wear really larger ones, then a little bit higher is going to be better. If not, maybe a little lower. But for the most part, the only anatomy, and it does depend on your anatomy, the main anatomy thing is to make sure that it can be done to match the outward curvature and everything of your upper lip, but still is not going to be right up against the florineum tendon on the top of your mouth or cause damage to it or actually pierce through it. So it really is kind of anatomy versus what you want. Now, when you're looking at the markings, I always suggest looking at them up close and then at arm's length or further. Most people don't see you from 3 inches from your face, so they're going to be seeing you from far away, and they're going to take into account how your whole face fits together. So a lot of times something may look dead center when you're this close, but at arm's length, it looks a little off. Always kind of compare the two of them. Also move your head up and down and kind of adjust and see how it looks. Now we're getting to the piercing part. I know it took us a while to get here, and it usually does, because the piercing part's always like that much of the whole thing, and everything else is the other part. So, first thing you're going to do in most cases is they're going to clamp the area with a set of Pennington forceps that flattens out the tissue and keeps it straight. It gives us something, kind of a guide point to know what angle to do that at. The piercing is done outside to inward. If it's done inward to outward, it generally means that the person doing the piercing is using externally threaded jewelry, and you should be in that studio. Now, the piercing is done in and through. Once that's done, the forceps are removed. A threaded guide pin is used to push the needle out. The jewelry is then threaded onto the guide pin on the inside of your mouth, and then it's pushed outward. And then the ball or whatever end is attached to or screwed on there. Sometimes we use hemostats. Sometimes we'll use different pliers or tools to get the jewelry on and get that end on there correctly, because they tend to be kind of small and kind of hard to work with. Plus, it's kind of hard to grip that disc in the back and not pull it outward. So we use hemostats. It just makes life easier. Once it's done, there might be a little bit of slight bleeding, usually not a lot. Sometimes you might see a little bit more bleeding because as that taper pin goes in or guide pin goes in, they're usually tapered. So there's kind of a gap there for a minute as that jewelry's threaded on there and pushed back through. So the piercing's kind of a little bit more open than it usually is. Usually you get the same effect if you pierce with a needle larger than the actual jewelry. You'll see a little bit more bleeding. Usually not anything profuse or anything you need to worry about. You might see a little bit of blood on your teeth, just to let you know. And that's what rinsing is for. At this point in the piercing procedure, I usually ask the person after cleaning them up, how are you feeling? And if they're feeling fine and they're not lightheaded or anything, I'll ask them to slowly get up and rinse if there's blood on their teeth. If not, to do the best part of getting a piercing, the fun part, the part everybody likes, going and looking at it. Now, when you look at it, you're going to freak out a little bit maybe, because usually that post is kind of sticking out there a bit. That's normal. We want that extra room there, and sometimes this can make it appear like it's not angled correctly. It is more than likely angled correctly. If it isn't, you need to talk to your piercer and discuss that with them, the possibility of re-piercing. Not that day, a different day, or what have you. One thing I forgot about with the marking, but, you watch the whole thing, don't you? Anyway, it's usually a good idea, and I usually ask my my clients to kind of move, smile, talk a little bit so you get an idea of how much they move their upper lip and what is going to work best for them and what's going to look best. Healing the piercing. Now, with Medusa piercings, you can see an average healing time, if you're really healthy and lucky, maybe around 2 months, probably more realistic, 3 to 6 months. It's pretty rare it'll take that long, but every once in a while you have somebody that just takes a little bit longer. During that time, you're going to be cleaning it twice daily using a sterile saline solution. Personally, I like Nelman's Piercing Aftercare. You can usually find it at good piercing studios. The wound wash version, usually you can find at Walgreens, Walmart, Target, CVS, lots of different drugstores, or an equivalent. Mainly what you want to look for is that it's sterile, it's in a can, and it is 0.9% sodium per distilled water. A little different when you use the kind that comes out in a high-tension spray, but usually with that I suggest doing compresses. For the first 2 weeks, you want to rinse a couple times a day with Biotin antiseptic mouthwash. Also do saltwater rinses with warm water and sea salt. I do suggest using distilled water just because it's cleaner. Now, it's important with swelling. You're probably going to see the worst of the swelling about the second day in. Some people, day after, it swells. Most people, for some reason, with lip piercings, like Labret piercing, etc., it takes like a day for it to come in. Now, let's talk about reducing swelling. Swelling is going to occur usually the day after or the second day after. It varies from person to person. Everybody's a little bit different. You can reduce the swelling by cutting down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, anything that may agitate your mouth. If it hurts to ingest it, including vaping, you probably shouldn't be doing it. I had somebody recently go, but cannabis is an anti-inflammatory. If you're smoking it, it's going to agitate the piercing, which is going to lead to issues. It's a little bit up in the air whether or not the edibles would do the same thing. I personally would not want to test it. Now, you want to go ahead and stay very hydrated. Drink lots of cold water, liquids, etc. Avoid movement. Avoid over-talking, playing with the piercing, etc. Eating complex meals that involve a lot of chewing or opening your mouth wide can be very uncomfortable at first and should be avoided. The more that jewelry moves, the more it gets bumped, the more it's agitated, the more swelling you're going to see. Cold items are fantastic. Raid the freezer. Get out those tasty treats and have at it. Also, smoothies, yogurt. No, yogurt does not cause yeast infections. Covered this already. Simple foods, baby food, applesauce, anything that doesn't involve a lot of chewing is going to be your best option. The other thing you want to do is reduce drinking liquids that are high in sodium, like soda and etc. Sports drinks would be the other option. Sodium, salt will increase the amount of swelling you see. The other thing most people forget to mention is sleeping with your head above your heart, elevated. This will help reduce swelling because you're probably going to see the worst of the swelling when you wake up. If you're laying flat on your back and your heart's in the same direction, more blood flow goes and more swelling. Lastly, over-the-counter anti-inflammatories. If you've never had issues, I'm not a doctor, neither is your piercer. We can't prescribe these things to you. But if you've never had issues using things like ibuprofen, Tylenol, Aleve, etc., or other anti-inflammatories, or you've had good luck with them, they can help a little bit. The swelling is going to last anywhere from 3 to 5 days, varies from person to person. The other thing you need to do is avoid contact with the piercing and practice cross-contamination prevention. I've talked already about this, but clean your hands, no oral contact, deep mouth kissing, or sexual contact. Practice safe sex. Keep your environment clean. No swimming. Keep pets away. Avoid playing with the piercing or excessive movement. I talked about this a little bit earlier. If you can spend a couple days not talking or talking very little or closed mouth talking, that's going to be better than constantly moving it and agitating the piercing. The same thing goes to eating. If you're eating things that take a lot of chewing, even if you can, it's just going to increase and prolong the swelling. Simple is better. Avoid trauma and contact with the piercing. I know accidents happen, that's the way it is, but do isolate that piercing and try to keep things away from it. The other thing is downsizing. I generally suggest waiting at least roughly about 2 weeks to about 20 days, 21 days before you downsize. The swelling should be completely done, so we have a good size. But downsize that shorter barbell is not only going to make your life easier, but it's also going to reduce that likelihood of enamel erosion, gum erosion, and softening the bones inside your mouth. Jewelry. Jewelry should be worn at all times. This piercing, like all oral piercings, can close very rapidly. You do want to leave something in it at all times, only taking out to replace. When in doubt, get it professionally changed. Especially when downsizing the first time, it is best to go in and let your piercer do it. With this one, you can pretty much only wear Labret studs with that disc in the back. Other jewelry does not work well in this particular piercing, like rings or circular barbells and etc., just basically because of the location and what it's going to come in contact with. It should be internally threaded jewelry. Avoid externally threaded jewelry whenever possible. It is cheap, probably going to cause damage, and the balls are going to constantly fall off. Now, I'm going to speak a little bit about threadless jewelry. I've had some clients that have had good luck with it. I'm always a little leery of how secure it's going to be, but it is a possibility. The problem is if that does come off, it's easy to swallow that back or chomp down on it and cause damage to your teeth. Now, the jewelry should be made of an implant-grade material, meaning that it should be titanium and certified implant grade, 14-karat solid gold, not filled, and you might be able to get away with implant-grade stainless steel if you don't have a problem with nickel. However, it's always best if you got it, you can find it, go straight with titanium. It's the one that the least amount of people have reactions with. The jewelry should fit tight to the body, but not overly tight. It shouldn't be digging in. Often with these piercings, because the tissue is so soft on the inside of your mouth, it will nest. It'll almost pull into the piercing. The only time you really need to be concerned about this is if the tissue seems like it's forming around the jewelry, around that disc, then you should probably have it checked out immediately. However, it feels more comfortable for it to nest and kind of pull away. The ends should be checked on a regular basis. The front always comes unscrewed. I usually suggest check it weekly. If you notice that it keeps unscrewing, check it more often. Or get a better quality piece of jewelry. Lastly, if you have a situation where, for medical reasons or whatever, that you need to wear a retainer that is non-conductive, I would suggest wearing glass. You can wear it for short periods of time. Glass retainers, and they do sell Labret-style retainers. Living with a piercing. You may want to brush off, some people, not everybody, that plaque will start collecting on that disc on the inside. Brushing it or using an anti-plaque rinse will usually get rid of that. There's no reason to completely remove the jewelry and clean it every day or every other day. The more you change jewelry, especially during the healing and immediately afterwards during the seasoning, the more likely you are to cause damage and possibly start the whole healing process all over again or have an issue where you can't get the jewelry back in. So just try to do it in place. As I mentioned already, check the ends on a regular basis. They can come unscrewed, and they will fool you. You have them for months and months and months, and nothing happens, and then all of a sudden, out of the blue, the thing's rolling across the floor of the bar, and you don't want that thing back. So do check them on a regular basis. Even after the piercing is healed, I've had numerous clients mention that eating large objects, that sounds weird, like a big hoagie sandwich that's like this thick, is uncomfortable. Something about, because you're stretching your mouth out so much, and that it's more prone to getting caught on teeth and etc. when you do that. So it's really something you want to consider beforehand and actually during the living with the piercing. Monitor your gums and teeth on a regular basis. If you start getting hot spots, sore spots, you start to actually see physical erosion, take the jewelry out immediately. There is nothing you can do. There's no jewelry you can put in there, what have you, that's going to fix the problem. It's at that point, and there's nothing you do other than remove the jewelry before it causes further damage. The jewelry in at all times. You don't want to be taking this out, leaving it out for 3 or 4 days and trying to put it back in. Chances are it's going to close on you. There are the exception, rare people that can have this piercing, take it out for months and years on end and have no problem getting that jewelry back in, but they are rare. Always practice safe sex when switching partners. If you're going to be partaking in some oral activities, definitely use some type of latex barrier. Abandoning the piercing. Now, if you've gotten to the point where you have to remove the jewelry for whatever reason, or life change, or your mind's changed, or what have you, if there is damage of any type inside your mouth, gums, bones, etc., do it as soon as possible. Don't put it off. Don't try putting plastic in there, because that's not going to help, or anything else you may read on the internet. Silicone rubber ends and all this other stuff is not going to stop the fact that it's rubbing against there and it's causing problems. The other thing with plastic is it can be harmful. I don't ever suggest using plastic as a retainer or any other type of jewelry. If it's still healing and there are signs of infection or other problems, consult your doctor or piercer before removing the jewelry. If it is infected, there is a risk that as your body heals infections by pushing that tissue, first it isolates the tissue, infected tissue, then it slowly pushes it out of the body, usually through the wound. If you suddenly close that wound, there's a possibility of it getting trapped in there and creating an abscess or a cyst, which means you'll need medical attention. So anytime there's a problem, don't just take the jewelry out. Talk to a professional, have them take a look at it, and see if it's okay to remove it. If it's still healing and you decide you're going to remove it, but it looks healthy and there's no issues, then you just want to monitor it just like you would any other cut or puncture wound you have on your body. If there's any signs of infection or other problem, contact a medical professional as soon as possible. If the piercing's healed and you just want to get rid of it, removing the jewelry is not going to be a problem. It'll slowly begin to close. Don't be surprised if the piercing appears open for years afterwards. These piercings are prone to that. That indentation scar may be there for 10, 15 years in a lot of cases, and then even at the end of that 10 or 15 years will still be somewhat noticeable. One final thing, because this piercing takes a long time to fill up completely, is that you will often see what is this kind of waxy substance. Has the consistency of cream cheese and smells like toe jam. What that is it is sebum. Sebum will collect in piercings, often around scar tissue. It's a natural part of your body, smells bad, etc., but it's perfectly healthy and safe. Just clean it off. That's all you need to do. Till next time, here's hoping your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. And I'm sure Shannon does too. Have a good day, everybody. Thank you for watching, and we'll see you in the next video.